so much for coming tonight. I am so excited about our speaker. I have a little bit of information on him. Dr. Andy Tao is a gastroenterologist who was born in Corpus, but he is first generation Chinese American, where his parents immigrated from Taiwan. And they're citizens, so we don't have to worry about his parents.
Thank God, we're good, guys.
He speaks fluent English, Spanish, and Chinese Mandarin, so I'm sure that's very, very helpful. In 2021, he was voted by the Travis County Medical Society as the Young Physician of the Year. So there are a lot of docs. And I asked him how he did it, and he said, I just worked a lot of hours. So that's good. During COVID, he was the hospitalist, the GI hospitalist that stayed in the hospital all the time during COVID.
Oh my God.
Yeah, so that's what the youth gets too. You're new, you're in, you're it. Has 2 children, a boy and a girl, and now this is what you're going to have to think about. Dr. Tao played football at Harvard.
All right. What do we have to
I wasn't that good, don't get on first.
But he played, and you get to vote whether he was a middle linebacker, a tackle, or a center. So think about it for a minute, and we're going to vote. Okay, who says he was a middle linebacker? Who says he was a tackle?
I can spin around for that.
And who says he was a center? Well, not a center, although that was the largest vote. Not a tackle, although that was the second largest vote. He was a middle linebacker.
Right.
Yeah. That's because I got kind of fat over the years, so those other votes kind of make a little more sense.
Anyway, let's give Dr. Tao a wonderful warm welcome.
Thank you guys, it's a great privilege to be here, and I want to talk to you guys tonight about not that popular of a topic, something that you might not see at that lovely dining center. No one's going to be talking about these topics, but it needs to be discussed, okay? I want you guys to look to your left and look to your right. All right, one of y'all has symptomatic hemorrhoids. That's guaranteed, okay? It's that prevalent in the United States. And it has a lot to do with constipation and other risk factors that I'd like to go through. And tonight, I'd like to go through kind of a higher level view of this. I actually made this presentation for primary care doctors. Some of you may be physicians out there themselves. But this is gonna be kind of an expert level talk. So this is more of this is probably more than you want to ever know about your bottom side, but here it comes. All right. Tonight we're going to talk about what are hemorrhoids, all right, what are the types of them, and then what are anal fissures, and what's a thrombosed external hemorrhoid, which is one of the most painful things you can have in your body. And what are some lifestyle and medical therapies that you can overcome, and how do we manage constipation? Because really one of the biggest problems with hemorrhoids is that they're caused by constipation. So hemorrhoids are actually swollen vessels that are in your lower rectum or your anus, and they actually have a purpose. They provide 15% of your continence to keep your stool inside you, okay? The problem is that when you strain, as you get older, as you get more constipation, and you live a more sedentary lifestyle, the pressure of gravity and all of the weight that you accumulated over your life, including yours truly, it puts pressure directly, a vector that goes right towards that bottom part, okay? And that pressure compresses the outflow tract of those hemorrhoids, right? A hemorrhoid has an inflow tract and an outflow tract. And when you put all that pressure on the outflow tract, blood is flowing in, but it can't really get out, all right? So sitting too long can cause those hemorrhoids to flare up. And if you ever go on a long trip or a vacation, and you're like, gosh, why are my hemorrhoids and my constipation getting worse? It has to do with that. It has to do with that. In long trips, you tend not to walk as much, and the GI tract, we'll talk about this later, but it needs to feel the pull of gravity. If the guts don't feel the pull of gravity, they tend to slow down. Now there's kind of two types of hemorrhoids. There's really a third type, but I want to talk to you about the two main types. One is internal. You can't see these. They're literally where the sun don't shine, okay? And they're only things that the GI doctor can see, unless they get so large that they prolapse out. They're supposed to be an inside dog, but sometimes you'll come on outside, right? And then sometimes you'll go back inside, and that actually determines how bad they are, whether they go in and out or they actually stay out. But they're supposed to be inside, all right? There's another type that's external. Oh, by the way, the internal ones, they bleed and they prolapse, they come out. The external ones, they always live outside. They're a permanent outside dog. Okay? They never go back inside. And they cause itching, and they're like these little bumps. Sometimes they're hard to wash and so on. They're on the outside and always on the outside, okay? They're more of an annoyance than anything particularly that dangerous, okay? There's one thing about the external ones, though. They can get thrombosed, and that's very painful. The external ones can get thrombosed. What does that mean? Remember how I told you if you sit for too long, the outflow tract will get blocked, right? And then the flow will go in, but it can't get out. Well, the hemorrhoid will swell, right? When the hemorrhoid swells, and it's on the outside of your body, which is cooler than the inside of your body, and you go out to Colorado or somewhere beautiful and cold, or you sit on a cold chair, for example, if blood cools, it clots, okay? So a clot will form inside that already engorged hemorrhoid and become a solid material. Huh? And then you stand up and you should be fine, right? No, you're not fine. That clot will go and jam itself into its own outflow tract and will block itself again. And then and that'll never relieve for a while. It will, but you need the doctor to help it. It'll get blocked, it'll get swollen and become very painful. And the only way to kind of overcome that is for the doctor to incise it, to make a little cut and get the clot out of there, and then you'll feel better, okay? So if you ever have something in your bottom, and it's very painful, and it feels like a little worm, and of course you can't see it, you can just feel it, right? And it's hurting really, really bad. I don't even need to look at it, I already know what it is. You just call me and I'll say, I'll take it. All right. This is what the internal hemorrhoid looks like. I'm telling you, ladies and gentlemen, this is gross pictures, okay? So I'm trying to make them as PG-13 as possible. We're all here to learn, so just get ready. Everyone's had dinner already, we're fine, okay? The internal hemorrhoids are on the inside, just like that, and the external ones are on the outside. That's your rectum, okay? All right? There is a line that separates the internal from the external, okay? And that line is called the dentate line. And the very interesting thing is that what's below that line has pain. So pain sensation exists below that line, but everything above that line, there is no pain. So that means operating on internal hemorrhoids actually is not that painful because there's no classic pain fibers down there. Now, external hemorrhoids are exquisitely painful, okay? Grade 1 hemorrhoids, they're inside. Grade 2, they come in and out. Grade 3, they come out and they can only go back in if you push them in. And grade 4 internal hemorrhoids, they're inside dogs that never want to go back inside, they stay outside. And these different grades are very important because grade 1 and 2 are my business. I can help you take care of those either medically or ban them. Grade 3, it's starting to get to the surgical side of things. If you have a hemorrhoid that comes in and out and it requires you to push it back in, you might need surgery, but there's a chance that I can ban them, called ban ligation, when we get to that in a second. Once it's grade 4, it pops out and it won't go back in, surgery is the only way to fix it, all right? Now, here are the risk factors. Risk factors are, what are the things that help cause these painful things or these annoying things to happen? 1, pregnancy, right? When you're pregnant, Zoe knows this, well, not to point you out, but my lovely marketing director just had a little baby. When you're pregnant, you're carrying extra weight. On top of that, there's a lot of hormones and other things that cause a lot of pressure in that area. Obesity, the same thing. Constipation, well, if you're trying to push out a very hard stool, well, the hemorrhoids don't know any difference. If they're swollen, they want to come out too, except they're attached, right? So they think, oh, let's go with the stool, but no, they're attached, and that constant pull and tug makes them larger and larger. Now, the way to combat this is eating more fiber when we get to that later, okay? Prolonged sitting, straining too hard. Interestingly, chronic diarrhea also causes hemorrhoids to get worse because you're sitting on the toilet for a lot longer, right? And there's nothing worse than sitting for a long time than to sit on a chair with a hole in the middle of it, which is a toilet, okay? Because there's really just no support there at all. And then anal intercourse sometimes. All right? Now, how do you prevent hemorrhoids? If you're not paying attention, this is it. Listen to this. All right? You want about 30 grams of fiber in your diet every day. All right? Every human being should try to achieve that. 32 grams. And you need 64 ounces of water. Okay? If you eat this amount of fiber in this water in this ratio, you can achieve most people can achieve what I consider to be the golden bowel movement. All right? The golden bowel movement is where you sit down and it leaves your body with minimal effort. It's so clean you barely have to wipe. Okay? Please do wipe, but it's that easy. And you do need two different types of fiber. I don't want to get too involved in this, but there's soluble fiber and there's insoluble fiber. Soluble fiber is found in lots of fruits and vegetables. They're the things that cause fruits to hold on to a lot of water. One of those, the classic one, is kiwi. You see a cute little kiwi with a little fuzz on it?
Yeah.
Squeeze it in your hand. You can't imagine how much water is in that thing. I mean, you know, because when you go to the grocery store and pick up a kiwi, you know, I always am remarkable that it's so heavy. It's so small, but yet it's so heavy because it holds a tremendous amount of water. It has a lot of soluble fiber in it. The easiest soluble fiber to get into your body is actually powdered fiber. Metamucil, benefiber, citrusol. Okay, those things absorb water like crazy. Okay, so you need soluble fiber and insoluble fiber. What is insoluble fiber? It's roughage, guys. Right? It's kale. It's salad. It's these things. It's what I call the rebarb of the stool. You guys know what rebarb is? You lay concrete in it, right? Soluble fiber is the powder to make the concrete. The rebarb is what holds it all together. If you get the right ratio of soluble and insoluble fiber in your stool, it'll be soft, it'll have some bulk, and it'll all hold together. And I hate to keep talking about stool with you guys, but that's just, as I chose this life, that's just perfection for me. Right? It's so easy to just come out. And that's what I hope for all of you. Okay? The other thing that you can do to prevent hemorrhoids is to actually elevate your legs. There's actually this device called a squatty potty. It was on Shark Tank. I thought it was just total BS when I saw it, until evidence-based studies started to come out and show anatomically we ought to be elevating our legs when we have a bowel movement to help open our rectum a little easier. Okay, and in fact, it makes a lot of sense because in Asia and the Eastern Hemisphere, everyone squats to have a bowel movement. And many years ago, I went to see my grandfather, and he was living at home as they all do. And I asked him, Grandpa, you're 90 years old. How do you squat to have a bowel movement? I just can't see you doing it. And he said, well, how long do you think I'm squatting for? And I said, well, I don't know, Grandpa. It takes me about 5-6 minutes to have a bowel. 5-6 minutes? He told me 5-6 seconds. He said, when I'm halfway down, it's halfway out, you know? Toothpaste, a bottle of toothpaste, it's coming out already. He said, that's been trained. I can't reverse that. That's just how it is. My grandfather squatted his entire life to have a bowel movement. Now, I didn't look at his anus, but I'm pretty sure he doesn't have hemorrhoids. Limit your time on the toilet, less than 3 minutes and less than 5. And you shouldn't bring your phone to the bathroom. That's bad behavior. And if you haven't figured out yet, a bidet are one of God's greatest creations. Okay? It avoids traumatic wiping and actually gets you a better cleanliness. Some people think it's weird, but that's because you hadn't tried it. When you're sitting on the toilet and you realize you forgot your phone, don't be forlorn. That's a good thing. Okay, and you get your business done and get out there. Okay, 3 minutes at best. When you elevate your legs, your rectum actually straightens out. Okay, so it makes for a much more easy, less straining type of bowel. Okay, that's a squat body picture. Yeah, you can see it there, can't you? Yep, there's an Eastern Hemisphere toilet. That's what my grandpa's been using, or he had been using for a long, long time. Okay, now if you get hemorrhoids, the first thing everyone thinks is, well, I'm going to go get some preparation H. And that's a good idea. Did you know that the most shoplifted item in a pharmacy is preparation H? That's a fact. That's a fact. Okay? It all makes sense because you don't want to see that lady when you're checking out. She's like, preparation H. You don't like that conversation. Just steal it. Just kidding. Don't do that. Now, preparation H, it has glycerin, which is a protectant, kind of like a Vaseline. Phenylephrine is actually a vasoconstrictor, which means that it helps stop bleeding. Okay, it causes the vessels to contract. And it has promoxine, which is an anesthetic, which, if you have burning, it can help with that. It's like lidocaine, okay? And then it has petroleum jelly, which is another kind of lubricant and protectant. So it's a good compound. It's not strong, but in a pinch it'll work, okay? The other thing to do when you have hemorrhoids of any type that are symptomatic is to do what's called a sitz bath. Right? A sitz bath is where you take warm, almost hot water, and you add some Epsom salts in there, okay, and you soak in there for 10, 15, 20 minutes. It relaxes the anal sphincter, allows for good blood flow, and really what it does is it helps dehydrate the hemorrhoids. If you put yourself in a bath with some salts in it, and you put your hand in the water for 15 or 20 minutes, you take your hand out, it's wrinkled. I want that for your butthole. Right? I want that for the body. Right?
Okay.
That way, it shrinks up, it gets smaller, and it gets better. It's less symptomatic, okay? Preparation H is good for bleeding and pain. For itching, this is the finest cream that you can ever have. It's sold by a consortium of colorectal surgeons. It's all natural ingredients. It's made by menthol. It has a lot of menthol oil in it, so when you initially put it on, it feels very cold, right? But it tricks your nerves and it really causes the itching to stop. And Predicure is, we own 2 jars in our house alone. It's wonderful stuff. The quality is so well controlled, you can't buy it on Amazon. You actually have to just go to the manufacturer. Right? If you get a really bad itching, and no matter how much cleaning you do and so on, you have really bad itching, you need to think, oh, maybe I'm getting a diaper rash. So you can use Lotrimin for that area. That's particularly true if you just took antibiotics, right? You can get a yeast infection where women naturally get it, or you can get one around your anus too. It's all the same process, and sometimes because it's a lot of moisture, and the antibiotics can put you at risk for that. How do you take a sitz bath? You find a clean tub, you fill it with 2 to 3 inches of water. It's not really a true bath, okay? And you lean back, relax, and you soak for 15 minutes, and then you just pat dry. Don't rub too hard. Now, external hemorrhoids, the ones that are on the outside, that are always on the outside, surgery is really the only option to get rid of them, but I don't strongly recommend it because it's pretty painful, okay? And in some ways, it's just aesthetic. Just, people don't like the way they look or they feel or whatever, but they rarely ever cause problems. Unless, like I said, if they get thrombosed, and then you have to have an incision and drainage, okay? We'll save you these pictures. There's no surgeons out here that care about this, but suffice it to say, we know how to get rid of them, okay? Now, if an external hemorrhoid gets better over time, it becomes a skin tag, just a little remnant piece of skin. And they're annoying and sometimes hard to wash, but they don't ever really cause any problems, okay? Now, internal hemorrhoids that bleed, remember the inside ones, they can be, if they're grade 1 and 2, which means they either stay inside all the time or they come in and out, that you can actually take care of them without surgery. There's a middle point between just lifestyle changes and surgery, and that middle point for internal hemorrhoids is putting a band around it, all right? And I don't know if anyone here has ever raised cattle, or there's gotta be some legitimate rancher Texans in here, but it's the same way as we castrate bulls. Anyone know how this is? You put a big rubber band around the bull's testicles. That's it. That's all you do, right? And like 10, 15 days later, they fall into the ground, right? There's no pain involved or anything like that, right? So we do the same thing for the hemorrhoids. We tie a rubber band around them, and painlessly they kind of just fall off, okay? It's actually quite genius because when you put the rubber band on it, it stops the blood flow to the whole system, including the nerves. So it's actually painless, okay? I mean, I never asked the bull, but I think it's painless. When you put the band on there, it gets rid of the excess tissue, it gets rid of some of the blood flow, it reduces the size of the hemorrhoid, and it actually leaves fibrosis or scarring that tacks that hemorrhoid up there, almost like a facelift for the rectum. So it can help prevent prolapse as well. So it reduces the size, it reduces the blood flow, and helps prevent it from prolapsing because you kind of tack it up. I always call it like an anal rectal facelift. You can go from this to that. Oh, so beautiful, right? Yes, but for your anus instead. Okay. Now, what about an anal fissure? An anal fissure is extremely painful. Now, keep in mind, we talked about 2 painful things: a thrombosed external hemorrhoid, and this is the other thing. But this anal fissure, unlike a thrombosed external hemorrhoid, you can't feel this. It's actually, it doesn't actually have substance or volume. It's a tear in the anus. It's a literal tear. And it happens when you get very, very constipated and pushing too hard, okay? And it feels classically like when you're passing a bowel movement, you're passing glass. So if you ever come to the doctor and say, oh, doctor, I have these hard stools, I've been on a vacation and I haven't been eating all my rubbish, and I passed a bowel movement and I felt like I was passing a piece of glass. Right then and there, we know the diagnosis. It's an anal fissure. And the treatment for it is sitz baths and ointments that can be compounded, okay? You don't even need a rectal exam. If you tell a doctor that you're passing glass and they try to put a finger in your rectum, punch him in the eye. No, I'm just kidding. But they don't even do that, okay? We actually joke that if they do, they'll see the chandelier sign. You know what a chandelier is? They'll jump up and hit the chandelier. It'll be so painful. So don't let them do that. It's unnecessary. Okay? Yeah. Now there's a vicious cycle from an anal fissure. It begins with the anus getting cut, usually from constipation. That results in pain. And then this sphincter, it spasms, right? And just like if I were to poke you with a hot knife, oh, you'd flinch just like that. You couldn't help it. You would just do it, right? And so every time a bowel movement comes by, the anus spasms. And that's exactly what it shouldn't be doing. If anything, it needs to relax to allow the stool to pass, but instead it spasms. And it causes persistent pain, and you end up, so if you're having pain when you pass a bowel movement, your natural reaction is to quit having bowel movements, to try to avoid it. You get scared of going to the restroom. But if you hold back stool, it'll get harder and bigger. And you can see that now you're in a vicious cycle. You're making yourself constipated. So the way to kind of crack this was to call me, and I'll get you a compounded ointment that has lidocaine in it, nifedipine, and I'll put you on some stool softeners. And after a few weeks, it'll get much better. Okay. Anal fissure ointments, there's different types. You don't need to know all this, but there's different formulations. That's for me to know and for you to get. They sell them at People's Pharmacy. I think Victory Medical Pharmacy, they're very cheap. There's one called Terrytown Pharmacy, not too far from here, so, right? It takes 8 weeks to treat it. You gotta apply the ointment daily. You just put a little bead and you bear down and you put it on there, and don't forget sitz baths and stool softeners. There's other things like Botox injections and surgery, but the vast majority, 95% of the time, can be managed medically. All right, let's shift to the last and most annoying topic, which is itching. Itching down there. What are the causes of itching? A lot of times, like I told you, it's a fungal infection. It's too moist. It's just like little babies. You get that little fungal infection, that little diaper rash. It's the same thing, right? Now, the little older kids, if you got little grandkids and they're running around scratching their butt and stuff like that, they may have pinworms, right? So, and they used to do this funny test where they put a little tape on the butthole, the nurses know, and they pull it off and they send it to the lab, and there's little eggs and pinworms down there. So, if you got little kids, you think about those things. If you take them antibiotics, you think about a fungal infection. The vast majority of the time, it itches because you're dirty. And I'm not passing judgment. It's not like you're not trying to get clean, but sometimes there's a little leakage, a little incontinence sometimes. Or, more commonly, if you have a hemorrhoid that moves in and out, every time that dog comes from inside the house to outside the house, he'll drag some stool with him. And he'll leave it on the outside, and when you go back, he's inside again, but he left the stool on the outside of the anus, and that causes itching, all right? So the best way to treat that, like I told you, is to get a bidet, okay? In the rest of the world, they have bidets. Here in the U.S., we just push our kids around with the toilet paper. There, they actually get clean, okay? Sometimes certain foods, especially spicy foods, sometimes can cause a local irritation, but that's very temporary. And lastly, there's some diseases that are actually of the skin itself that a dermatologist will have to take a look at and maybe just scrape it and get a biopsy. But the vast majority of the time, fungal infection, poor hygiene, or a food trigger. That's common. Like I told you, there's certain ointments that you can use, hygiene, and Lotrimin for fungal infections. When you're having a lot of itching, don't wear tight clothes. You want to use cotton or some of these special high-tech apparel that can allow for some breathing and some air movement through. If you guys want to see what a hemorrhoid, whenever I explain to my patients how to hemorrhoid banding, I just tell them I do it just like this. See this daddy? He's sucking up that cute little baby's hair. He turns off the vacuum and he deploys that little hair to boom, that's how you band a hemorrhoid. Okay. That's kind of how hemorrhoid banding works, right? Now, constipation and this population here is very often related, in my opinion, just because over time you're just not as active as you were before. And so I really kind of encourage you guys to combat that and try to be on your feet and let your bowels feel the pull of gravity every day, every day. I talked to you guys about increasing your fiber in your water. I want to tell you kind of how I do it. These are the different types of stools. Believe it or not, gastroenterologists grade these things. Can you believe that? Now, back to my point originally. What do I do on a daily basis? What I'm going to tell you I've been doing for 13 years, okay, ever since I became a gastroenterologist. I wake up in the morning and I make a green fiber, what I call a green smoothie, which is basically a fiber-rich smoothie. And I have different flavors, but right now I'm in a kind of an island, kind of Hawaiian mood right now. So I put pineapple, frozen pineapple, and I put some coconut milk in there, avocado. That's not weird, trust me. It makes it very creamy and delicious. And then I put in there some benefiber, some powdered fiber, and a big handful of greens. Lettuce or spinach, usually spinach or kale. And I just put in some almond milk and blend it all up. And I squeeze in honey there until I feel it tastes good, okay? And I drink that down. Right then and there, that's 15 grams of fiber, right there. It's not even 7:30 in the morning, right? I'm halfway to the finish line, okay? I follow that up with a strong cup of coffee, like an Americano or maybe a couple shots of espresso, okay? Because there's nothing more effective in terms of waking up the colon than caffeine, okay? Now, if you don't drink coffee, I'm not telling you to do it, but if you do it, it helps, it works. And if you do a little extra, it really does help. So now I put the fiber and the water in, that's the juice I like to call it, and now I put the squeeze on with the caffeine, and then I go for a walk. I'm gonna walk my dog, and that's the letting the bowels feel the pull of gravity. By 7:55, I'm on the toilet. If anyone in this room ever asks, I wonder what Dr. Tao's doing at 7:55 a.m., that's it, every day. I can't not have a bowel movement. You understand? I'm Pavlovian now. I sit on that toilet after that sequence. It's happening. And I hope that I can encourage everyone in this room to develop a similar regimen. That way, this is one less thing you have to worry about. Okay. So this green smoothie and the hydration, and the regular toilet time, the scheduled time, the same way Zoe, you're gonna train your baby boy the same way. Sit on the toilet, he doesn't want to have a good one, he doesn't know. You just give him a regimen and he'll do it, okay? There are medications for constipation. Some of these aren't really medications. The fiber supplements are not classified as pharmaceuticals. They're actually food products. Metamucil, benefiber, and citrusol are the three most common types of soluble fiber. Citrusol is very special. For some reason, it doesn't cause very much bloating at all. And so it's very, very common. A lot of young women take that one. They like that one. Okay. Now, when you're boosting your fiber intake, don't do it all at once. You got to slowly do it. So if you're only eating 12 grams of fiber a day, and I told you, oh, Dr. Tao said eat 30 grams. Well, don't do it all in one day. You'll be farting till Saturday. Okay? It's too much gas. Your machinery, your gut bacteria can't handle that much. So you got to acclimate, build it up over time, little by little. If that and caffeine and a walk doesn't do the trick, and the Dr. Tao special doesn't do it, the GI doctor's favorite two laxatives are either Miralax or magnesium citrate. They're both extremely safe. You cannot overdose on magnesium, really. And Miralax is really a miracle drug. Whenever someone drinks water in the human body, and it goes into the GI tract, the kidneys usually get first take. So if you're dehydrated, you'll absorb the water into your body. It'll go to your kidneys, okay, to hydrate your body. Whatever's left goes down the GI tract, and your colon will have the second take and absorb it. Okay, and then what's ever left over is what's in your colon. So you can see that's why the stool tends to be hard, because the water that you put down here, very little of it actually makes it to the end, to the other side. There is a way to bypass this system and tag the water so that it makes it to the colon 100%. And that's Miralax. Miralax is polyethylene glycol. When you mix that powder in the water, that water right there has been tagged for delivery to the colon only. It cannot be humanly absorbed into the body. It can't be absorbed. It can't be 100%. Every drop here will come out at the bottom. Okay, and it's very, very safe. Okay, it's so safe that I think maybe everyone here has probably had a colonoscopy before. It's one of the bowel preps that you can take. It's pure Miralax. Okay, and we give like 50 doses in one night, and we don't worry about it. That's how safe it is. Okay. If that doesn't work, if the wash doesn't work, there are some contractile laxatives. kind of like caffeine. Remember I told you it wakes things up and starts the contractions? Dulcolax and Senna cause the colon to contract. Now, those aren't the GI's favorite. We recommend you use that very rare, okay? Because there is some dependency with those. If you use those for a long time, your colon will expect it every day, and it will become weaker than when you first started. So you can only use it as needed, and rarely, please, okay? Stool softeners called Colace are just particularly very weak. Okay, they're good for maybe pre-op before surgery, but for real bad constipation, no, they're not gonna rescue the day. Maybe for maintenance. So how I do it, pun intended, that's my little regimen I told you guys, right? Poop at 8:15, usually 7:55 these days, honestly. And if you have help, if you need to seek help, these are the reasons. If you have bleeding, if you have a lot of pain and swelling, remember that'd be the thrombosis. And you've tried everything and it's not working, then you can give me a call. I have my card up here. I don't advertise that I'm a specialist in hemorrhoids and constipation. It's not the sexiest thing, but as I got older in my career, I realized it's really about just doing things that are meaningful, that help people, and that can reach a broad population. And so that's why tonight I really thank you for the opportunity for one person to have a platform to speak to so many. I appreciate y'all. Thank you so much.
Questions? Someone be brave, come on.
Every question that should be asked should be, I'm just asking for a friend here. That's fine.
Who had the question?
Over there. Oh, good.
Does green tea work as well as coffee?
It does not. It has only 25% per volume of caffeine. Yes. The Red Bull has about the same, but I'm not imagining too many people here drinking Red Bull.
What about decaf coffee?
Doesn't work at all. Doesn't work at all.
Anyone else over on this side before I go running over there?
Sometimes work on stomach problems.
Oh, his question was, do I sometimes work on stomach problems? All the time. I got both ends covered. Yeah, I'm just here to talk. Just because I'm a specialist in this doesn't mean that I'm exclusive. Yes.
Well, that's what I mean, and I had a rare instance 19 years ago when I was having this acid reflux, and they did both a colonoscopy and this.
Yes.
And I went, I'm diabetic. No, but I went to diarrhea for 30 days and ended up in the hospital. And after the caffeine was so low, I'm lucky I didn't have an episode of heart arrhythmia. And occasionally I can kill you.
Right. Yes.
So that's why we don't do this anymore. We're going for the Cologuard test. And unless it turns positive or something's really desperate, we're going to try to avoid doing that. It's rare this happens, but I did have that. I could have died if it had just been just right with a guy just dropped in the tube from constant diarrhea. That's dangerous level.
It is dangerous. And I believe that your experience is very unfortunate, terrible, and very rare.
Yeah, well, I'm one of those, so that's fine. But we haven't had much history of colon cancer in the family, just one blood and she didn't get those maybe she died of other causes 10 years later. So unless there's something good, they show the Cologuard test. It's not 100% effective, but it's fairly effective.
I agree with everything that you said.
Thank you.
I do.
Well, but my stomach reflux, here's another important thing. I guess you have to consider carefully, if they're taking over-the-counter medication or Regulin or something, is it going to affect your liver?
Yes. Well, I'll tell you, generally speaking, over-the-counter medications are extremely safe because the FDA believes that you can be your own doctor with it.
Yeah.
But there are limits to it, yes,
Yeah.
for sure.
Well, that's right, but just right now I've got it stabilized. I'm taking a Cologuard test every 3 years, and I will take special precautions, because maybe they got better preps than that electrolyte solution they had in 2006.
We have better preps, actually. Oh, yes, sir.
Yes, sir. The way we live and work these days, particularly with computers.
Mm.
And as a professor, you know, reading books, which you do constantly, you're sitting a lot.
Oh, yes,
And sometimes the seat gets harder and harder.
that's right.
And so do you have any advice, since we are, is by necessity, having to be somewhat sedentary.
Right.
And we also need to move. So I just thought I'd ask you about that because it's becoming more and more common.
Business is booming. But there are some clever ways to combat that. And I would say, number one, a standing desk is a modern day invention. And I always recommend that all my patients who have sedentary jobs set their timer on their desk to move up and down every hour, because it's really about changing the position. And I also tell them in their office, and most people do have space for this, to have two types of chairs. One, the traditional chair, and two, a very different chair. I don't know if you've seen these chairs. There's some chairs that, I know you're not gonna believe me, but you almost kneel in it, you know, and it forces you to be in a different position, or it has a different shape or so on, and it makes you put the pressure in a different location, right? And then the last thing I would say, Professor, is to actually buy a audiobook, right? And of course, you could traditionally read it for a while, then you can pause it, chapter 13, go to the audiobook. Now, what are you gonna do when you listen to the audiobook? You're gonna walk. You're gonna walk. Yeah, and that's one way to kind of combat these things in the modern world. Fabulous question. Thank you.
I had a question. What is your position on colonoscopies? I was told that if you've had years of colonoscopies at the regular times and they're all clean at a certain age, it's better not to have them. What is your advice?
That's a very good question. It could be an entire treatise written on this question. My bottom line is to, no pun intended, is to basically tell you that after the age of 75, if you had routine colonoscopies with very few or no polyps, the likelihood that you are going to die from colon cancer drops tremendously, right? Now, you may ask, well, what do you mean by that exactly, Dr. Cobb? Well, after the age of 75, there's a lot of scary things in colon cancer, and it takes a polyp 10 years to mature into a cancer. So there's a rule that we all learn in training. It's called the 10-10-10 rule. A 10 millimeter polyp, which is 1 centimeter, which we classify as large polyp, it has a 10% chance of becoming colon cancer in 10 years. So if at the age of 75 you had a colonoscopy, maybe your final one, and you didn't have any polyps, any, or what if you even had one that we missed that was just 10 millimeters? Well, then then in 10 years you'd have a 10% chance of having colon cancer, okay? And that's pretty low, right? And so, but you may ask, well, my mother lived to 108 years old or 105 years old. Well, that makes the equation a little different, because that means you're just a young woman, right? I mean, you got many more years. So some patients of ours who are in exquisitely good health at the age of 75, they look like they're 65 years old. Well, we keep doing colonoscopy because they're going to be here for a long time. And so there's not a single bespoke kind of answer for any given person, right? What if I told you, for example, that tomorrow artificial intelligence developed a drug that allowed us all to live to the ripe old age of 165? Well, then, some people are groaning here. But if I told you that, it wouldn't be 75, it'd be 140, right? So we would push that number. So the bottom line is there's no right answer for any individual person. It depends on your life expectancy and what your other comorbid past medical history or existing medical history is. Yeah.
Dr. Tower, could you address a little bit about probiotics and who should use them and how often and that kind of thing?
Yes, that's a fine question. Also, a treatise alone in that answer. Probiotics are the future, but right now they're a very, very blunt instrument. Okay, and it's not one size fits all for every person. Currently, every one of us is ourselves. We are a human person. We've known ourselves for a long time. What we're starting to realize is when you look in the mirror, there's actually two people there. There's you on the outside, and And then there's another organism that's been living with you your entire life that you've been carrying around. And if you count cell for cell, not pound for pound, you understand? Cell for cell. Every cell in your body counts as one, okay? Well, we are more walking bacteria than we are human beings. Okay, now you may say, that doesn't make sense, my poop is only so big, how can, no? Well, it's because the human body has a lot of water. Much like this earth, we're mostly just water, okay? But these little bacteria that live in our stool, they're not like this. So, the point is that you have an organism that lives inside you, and we're just barely starting to scratch the surface about understanding who is that other person? Who is that other Andy Tao that's living inside? What does he do inside? I know I am here. I know I'm a big Chinese funny guy from Texas who loves eating barbecue, but what about the one that's inside, right? And that's where we realize that probiotics has a role to play. Because when you put new bacteria inside your body, you can change that population a little bit. Now, I know the follow-up question is, well, which ones and how many and how frequently and for what benefit? At the moment, the best I can say is this. If you take antibiotics for any reason whatsoever, you will decimate the bacteria in your GI tract significantly. It's like a carpet bombing campaign for your GI tract. It kills tons of bacteria. But you don't need to worry, they'll grow back. Okay, they will grow back. The problem is they don't grow back in the same proportionality as before the carpet bombing campaign. They come back in different proportions, and they usually come back in worse proportions. More bad actors grow than good ones. So we know for a fact, and this is evidence-based, that after you take a course of antibiotics, or very shortly just before you finish, it is beneficial to take probiotics, right? To prevent the development of bad superbacteria taking over, one of which is called C. difficile colitis. Okay. Now, what if you don't take antibiotics and you're just otherwise healthy? What benefit is there to take probiotics? It's never harmful. No one has ever been harmed by taking probiotics. However, the right answer is more likely you're going to tell me than I'm going to tell you, okay? You're going to try different types of probiotics. One will work for you, one won't. You'll try different ones and you'll find one that, hey, this actually helps. My bowels are a little bit more regular and this helped me. I believe you. I believe you. If you find one that says this works for me, I believe you're telling me the truth, okay? And I believe you found the one and you should continue to take it. But here's what I don't want you to do. I don't want you to turn to your neighbor and be like, I promise this will work for you just as it worked for me. That is not true, okay? And now you know that's why that's not true. Because the gut bacteria that lives in you is not the gut bacteria that lives in you, right? It's all individual, it's all bespoke. So it's not one size fits all. Now, that's where we are currently in our understanding of probiotics, okay? But there's a new wave coming, and that's called artificial intelligence, okay? And these computers are extremely powerful and they can process huge amounts of data and what would take me 10,000 lifetimes to understand. And we're taking now these GI maps, basically all the bacteria in my GI tract. You can print out their names and see what profiles and what type of bacteria they have. But I don't know, when a patient brings me this map, I don't know what to do with this. I can't see the patterns in there, right? I can't, glean from that, oh my gosh, you've got to eat more papayas. No, I can't see that, right? I can't see that. But a machine might be able to see that. So one day, you may give a stool sample to a physician like myself. I take it, I run it through a high processing PCR machine. It punts out this entire profile of your entire gut microbiome. And then I tell it to run an analysis by inserting in some symptoms. Oh, this person's having a lot of constipation, and for some reason, when they eat bread, they get very bloated. And I put that in there and it says, have them take this probiotic, and boom, it's fixed. I think that's the future. How long it's gonna take us to get there, I don't know, but it's gonna be faster than we expect, that I can predict.
Anyone else? Oh, there you are. I'm coming
All
to
these
you.
questions are so good. Keep coming.
Can you just give us some examples of probiotics that we can buy when we go to the grocery
Yes.
store?
I'll tell you the most popular ones. I'm not endorsing any of them, because remember, it's all individual. But the most popular ones are one called Align, Culturel, and Floristor. Those are the three most common ones. Yes. And I believe Culturel is the one that has been studied most extensively to be taken after antibiotics. Culturel. Yeah.
Are you buy it over the counter?
They're all over the counter.
They're all.
Yeah. There are a few prescription strain probiotics that have billions and billions of bacteria, but that's not something you need to worry about. That's something for you.
You haven't talked about enemas.
Yes. This question is, can you make a comment about stool enemas? Yes. They're highly effective, but very annoying to do. Yeah, the reason that they work is because they push fluid into your rectum and they cause it to distend. And once it distends to a certain amount, reflexively you push and you relax your anus and it all comes out in a flush, right? And it also, of course, hydrates the stool and it's very effective. But it's onerous to kind of do it yourself, but in the hospital, the nurse is here, it's more than a little effective, yes. And ultimately, when patients get very, very constipated, ultimately, I'm just a human plumber, I tell them, do an enema first, get the bottom opened up, and then I start telling them to take a lot of Miralax, flush it out. And once they get enough Miralax in there, I tell them to drink a big, tall glass of coffee, and out it comes.
I cough.
Yes, sir.
Some of the drugs, as you mentioned, medications that we have to take cause constipation. So what's your best advice when we're already got something pushing us that way?
Yeah. And there are many medications that do that. The most common of which is actually pain medicine, like opiate medications cause people to be constipated. And then this new line of medicines, I'm not too sure how many people here are taking them, but these GLP-1 medications like the Ozempics and injectable medicines for diabetes that provide a lot of weight loss. And there's other ones that cause constipation. The key with those is that you need to preemptively take more fiber and more water or Miralax. That's usually the first line. Fiber, water, and more Miralax, okay? And then you can add on top of that, magnesium if you need, or a contractile laxative like Eucolax. The ideal situation though is to be preemptive about it rather than reactive about it, because then you're gonna be looking for medical.
You mentioned coffee. I don't drink coffee. What's an alternative?
Yeah, anything with a little bit of caffeine. And again, I'm not trying to push caffeine on anybody here, and if you don't enjoy taking it or it gives you an arrhythmia or something, please don't be pressured to take it. I just want to let you guys know that caffeine is a natural colonic stimulant, okay? Are there other things that can stimulate the colon? Yes, but they're not healthy for you. One of them is smoking. Like nicotine, for example, is once upon a time, someone in this room may have smoked it. If you had, you smoke, you drink a cup of coffee. As soon as you go back in the house, you're gonna have a bout, right? But I don't endorse that, of course. Tea, chai tea, green tea, they all have a little bit of caffeine. And the good thing is if you don't drink coffee, then you're very naive to it. So a little bit here and there actually may do wonders. Yes, ma'am.
We have coffee machines here, and unbeknownst to me, I was having a cappuccino with a shot of espresso in it every
Yes.
morning,
Yes,
and things change.
for the benefit.
For the benefit, yeah.
My point is that, thank you. A living example of this.
I think that's probably all our time. Thank you so much. We had wonderful. Your sense of humor made all of this much more digestible.
Oh, wow.
We've got some information on the front, and I'll put a little stack at the back, Dr. Tao's cards and some additional information. So thank you all so very much for coming. Thank you.
Thank you all. Have a good night.
Thank you.